This is NNI Bites, Big Learnings, a podcast where fellow healthcare professionals share conversations on nutrition science's latest. We are joined by Professor Gary Wong and Dr. Carina Venter as they share their knowledge and insights on maternal diet and complementary feeding diversity on allergy prevention.
Hello, everyone. Welcome to this special podcast at NNI Bites, Big Learnings. The topic for discussion today is maternal diet and complementary feeding diversity on allergy prevention. Together with me, I have Dr. Carina Venter from University of Colorado, Denver. Welcome, Carina.
Hello, Gary, and thank you for the introduction. I'm a professor of pediatric allergy and immunology here at Denver, Colorado, where I also work as an allergy specialist dietitian. And I find nutrition, particularly relating to nutrition during pregnancy and early life, on infant allergy outcomes of huge interest. I look forward today to our discussions focusing on maternal diet diversity and how that may prevent infant allergy outcomes. And so I hope that people will join us on the podcast, NNI Bites Big Learnings, for further discussion of the topic.
Yeah, on this very important topic, I'm sure we meet a lot of parents on a day-to-day basis asking this very important question. What are the current recommendations for dietary intake during the pregnancy or during lactation in order to minimize the development of allergy in her infant?
That's a really good question, Gary. And I must say that I have been involved in many of the guidelines on allergy prevention across the world. And so in terms of food allergy, we have very, very little information that we can give to parents. And internationally, the recommendations for food allergy prevention during pregnancy and lactation is to advise mothers that there is no need to avoid food allergens to prevent food allergy in their infants. But we actually do not have enough information to say that they must eat the allergen. So basically what it means is if they are having milk in their diet, they can keep it in, they don't need to take it out. But if they do not have any milk in their diet, we do not have the evidence to say that they absolutely now must introduce milk in their diet to prevent their child from having a milk allergy. There's currently no recommendations for the prevention of atopic dermatitis. There's also no information for the prevention of allergic rhinitis in the infant. But the GINA guidelines, which is the Global Initiative for Asthma, recommend that in mothers with low vitamin D levels at the start of pregnancy, these levels need to be corrected for the prevention of wheeze in their infants. And this is really all we can say to parents at the moment, which is driving my interest to come up with better guidance for those mothers in my clinic that's very distressed and want some information on how to prevent allergies in the child that they are expecting.
Great. Along on this topic, an important question sometimes we need to explain to mothers is how do we define maternal diet diversity and explain it to the lay public?
I think it's a question that I get asked by mothers as well very often. And I sometimes can see that they're disappointed when I say it's actually really very simple. Diet diversity merely counts the number of foods given over a reference period. So you can actually count the number of foods eaten over the course of a week, the number of different foods eaten over the course of pregnancy. You can just count the number of fruit and vegetables, or, perhaps even, the number of different hamburgers they ate during pregnancy. And so the diet diversity data we have in infancy consistently shows a reduction in food allergy and also other allergy outcomes in infants. But in all the infancy studies, we've only ever asked about intake of healthy foods because it's not normal to ask how many burgers did you give your baby in the last week. So the exciting thing for me was looking at the maternal diet diversity data here in Denver, Colorado, is that we could count overall diet diversity, so just all the different foods they ate over pregnancy. We could count the healthy diversity, so we divided foods into healthy and less healthy options according to the US dietary guidelines. So we counted the healthy biodiversity and we counted the unhealthy biodiversity. Very interestingly, looking at total biodiversity, we saw no association with allergy outcomes. But when we counted the healthy biodiversity, we saw a reduction in allergy outcomes. That was wheeze, allergic rhinitis, and atopic dermatitis. We saw an indication of reduction in food allergy, but it wasn't significant. The most interesting finding that we found was a highly significant increase in atopic dermatitis when the mothers had an increased unhealthy biodiversity.
All right. Following on that, what are the components of the healthy diversity versus the not healthy diversity?
That's another interesting question. And it really is at this point in time just any healthy food. So healthy foods would be fruit and vegetables and whole grains, some red meat, fish, healthy fats such as olive oil, and omega-3 fatty acids in fatty fish. And then the unhealthy diversity, we counted as things such as, takeouts or such as pizza or hamburgers, or perhaps fried foods. But then we also did a study looking at maternal diversity in Sweden. And we really couldn't count unhealthy diversity because the women primarily had a very healthy diet, consisting of fruit, vegetables, whole grains. Yogurt is an important component of healthy diversity, and then also fish. And interestingly, in the Swedish study, the mothers with the highest diversity, which was a really healthy diversity, had a 43% reduction in food allergy outcomes in their infants.
All right. So it's been really interesting over the past 10, 15 years, what we've learned from these large-scale epidemiology study and also these clinical trials in infants, how to feed them and whether, in the past, there has been an emphasis of avoidance. And looks like we have accumulated a lot of evidence going more towards exposure as well as diversity. So given what we know now, what other further studies do we need in order to determine the best possible maternal diet for primary allergy prevention?
That's a really important question, and I am currently applying for funding to do a maternal diet intervention. So slightly off the topic of maternal diet diversity, we developed a maternal diet index, which is a form of diet diversity, but really more of diet quality. And we showed that when mothers eat more vegetables and yogurt and have less red meat, less low fiber foods, less fried food, and less fruit juice. So they were having fruit juice opposed to fruit. So we wanted less fruit juice so they would eat more fruit in their diets. There was a significant reduction in infant allergy outcomes. And if we can do an intervention such as this, but also then in the analysis of the data count, not just the index foods, but also overall diet diversity, I think we'll be at a much better place to advise pregnant women. And I can also say that we have just submitted a paper where we looked at what matters most. Is it mom's diet or is it the infant's diet? And our data clearly shows that when it comes to allergy prevention, the maternal diet intervention is much more effective in preventing allergy than the infant intervention. And so I think we're really at the point in time where we need RCTs focusing on maternal diet in pregnancy and then following the infants over time to see what happens with allergy outcomes, immunological outcomes, as well as microbiome outcomes.
Yes, we have come a long way from, 10, 20 years ago when a lot of the recommendations are really on evidence or expert opinion. But over the past 20 years, we have indeed seen a lot of high quality epidemiology study, clinical trials telling us regarding, first of all, feeding during pregnancy. We should really get away from avoidance. This is also true for the young infants. In fact, exposure as well as the healthy diversity exposure, both of them are very important in contributing to the prevention of allergy. Because nowadays, 1 in 3 children in the developed world will have at least one allergic condition. It's so important for the parents and healthcare worker to keep up with the knowledge of these recommendations. And thank you very much, Carina, for joining us today for this very important topic. And I'm sure the audience will take home with these very important message and then spread it out to the community when they meet parents and their patients. Thank you again.
Thank you very much for having me.
And that concludes today's episode. Thank you for joining us with Professor Gary Wong and Dr. Carina Venter as we talked about maternal diet and complementary feeding diversity on allergy prevention. We hope you enjoyed and learned from this discussion experts and that this will be useful for your practice.